From our 22 News Broadcast Center, this is 22 News in Focus.
Good afternoon and welcome to 22 News in Focus. I'm Ciara Speller. According to the U.S. Census Bureau, there are more than 47 million people over the age of 65 living in the United States. This demographic accounts for nearly 15% of the total population, and it's growing as baby boomers age into retirement. While most people look forward to retirement, older adults face specific problems due to their age and life circumstances. Today on 22 News in Focus, we're going to be discussing some of the most common quality of life issues faced by older adults, as well as resources and support right here in the Greater Springfield area. On our panel today are representatives from Greater Springfield Senior Services, Inc. We have Jill Keogh, Executive Director, Taryn Lee Turgeon, Director of Adult Protective Services, and Anna Randall, Information and Referral Department Supervisor. Thank you for being with us today. So we have some questions we're going to be asking you. The first question is, tell us about the Greater Springfield Senior Services. What communities do you serve and what services do you guys provide?
Greater Springfield Senior Services has been around for 47 years, so we're well known in the community and very proud of that. We are designated by the state to be an aging service access point. So essentially it could be one-stop shopping for senior services. We get about 10,000 calls a month from seniors and their family members inquiring about our services. First and foremost, we're a navigator. People call us describing their situation, and then we're able to put them in touch with resources in-house or programs within the community. And that's one of the great things that Anna's department does.
All right, and what is the average age of your clients,
Well, it's getting younger. I would say it's probably upper 60s, and it really depends on the program. We have a number of programs. We also serve the younger disabled population as well, in addition to seniors.
And so, either one of you, what are some of the common issues or concerns that these seniors, come to you for?
Well, there's a variety of calls that we get, but probably the most common call would be affording and knowing when to get home care services.
Obviously, in protective services, any kind of concern that any elder living in the community over 60 is something that we look at in our department.
And so this might be a good question for you to answer. What are some of the specific issues in our region?
There's a lot of housing issues. There's a lack of affordable housing. There's a lack of alternative housing, such as shelter, should they need it. I'd say housing is probably a big one, but just generally needing the services, kind of that self-neglect, not knowing where to go and what to put in place is a big issue.
Did either of you want to add to that?
Yeah, I mean, I think one of the challenges that we're facing is we have seniors who need housing, and their housing stock really isn't there, and sometimes they're waiting 2 years on a wait list to get into housing, subsidized housing in particular. So it is a real challenge that needs to be approached by the state, and it's my understanding it is a priority of this administration.
Right, and so your organization has created an elder guide. So
Yes.
Walk us through that a little bit.
Sure. Elder Guide is a publication that we put out every 2 years, but it's also important to note that we have Elder Guide online, so it's updated on a real-time basis. But it really gives an overview of all the senior services in the community, and local businesses, Council on Aging's access this and sort of use it as their Bible, as it's called, to put their clients in contact with the right services.
And so how often is this information updated?
Online, it's on a real-time basis, so as soon as we become aware of a new service or a service that's changed, we're changing it, but the publication is changed every 2 years.
And so do you find that a lot of seniors aren't familiar with, this resource, the Elder Guide?
I would say so. Unfortunately, sometimes we're getting the call once mom or dad has fallen. So they're sort of in crisis mode, and they're calling us to see what services they can put in order for mom to come home and live safely and independently.
Now, where is your organization located?
We're located at East Springfield on 66 Industrial Avenue, off Cottage Street.
Okay, and what types of programs are offered at your offices?
I think the question is more, what isn't offered? We have so many programs. We try to meet the individual where they're at. So the call comes into Anna's department, and based on what the individual tells them, she can refer them to a myriad of programs. For instance, all the programs focus around keeping the elder in the community for as long as possible and identifying the obstacles. Are they at risk for losing their housing? Are they nutritionally at risk? If they are, we can put in home delivered meals. Is there a son or daughter who may be financially exploiting an elder? So we have our protective service department to investigate those complaints. So I think what's really great about our agency is that we really serve the whole person. We take a holistic approach and try to put in services to meet the needs of the elder.
And so you mentioned home delivered meals. Could you talk about that a little bit more?
Absolutely. We serve about 1,500 meals across our Springfield and the 11 surrounding towns. We not only serve regular home delivered meals, but we have Latino meals. We have a kosher meal site. We have medically tailored meals for those who may have cardiac or renal issues. So we try to appeal to all needs.
Yeah, so there's really an option for anybody.
Pretty much.
And so, the delivery service, when would that be? Is it a day-to-day basis? Is it weekly or?
It can really be whatever the client wants. Some prefer a weekly drop-off. Some really enjoy having their driver show up on their doorstep every day. They look forward to that visit, but it's also a check-in. Unfortunately, we've had our drivers find some of their clients, on the floor. They may have fallen, and so they're calling 911, or they're contacting protective services because they're not answering the door, or they've noticed a real serious change. So it can be a great safety check as well.
And so, did you want to add something?
I do. I think that daily check-in, sometimes it's the little things that can prevent the serious issues from happening down the line. I think it's invaluable to have that daily or even weekly check to bring them their meal, give them the company, and again, just somebody to lay eyes on them.
Right.
And families appreciate it too. I mean, we've had sons and daughters call us so thankful that the driver is going there and checking, and you really can't put a dollar figure on that value.
Right, and so do you have transportation services as well?
We can coordinate transportation services through other vendors, but we do have transportation in-house for our frailest seniors who may not have been successful on a traditional transportation program, but that's limited to our state home care clients.
Right, and so independence, that's obviously a huge thing. People they don't want to give up that independence. So do you find that that's, an issue when people first come to you, that they're struggling to have come to you in the first place?
Yeah, none of us like to admit we can't do something, especially if it's something we enjoyed in the past. So it's meeting people where they're at and figuring out where they want to go, what are their goals, and how can we get them there. If they enjoyed playing cards with their friends, maybe we're finding a transportation program at a senior center that has pitch every Tuesday night. We're trying to make those connections for them. So it's different for everyone, and I think that's one of the great things about our organization is we really try to take a person-centered approach.
Right. We frequently get calls from caregivers, well-meaning caregivers, who want to put services in for mom or dad or their loved ones, and mom and dad are not ready. And part of what we do is we kind of give that information to the caregivers and say, here's some services that are available when mom and dad are ready. It's creating that backup plan, getting the information to them before they need it.
I think the other important thing is you're not just getting a service, you're getting an advocate, you're getting someone who tries to understand you, who's trying to build trust, and really it's rare that you get this personal advocate in life, and I think it's great that folks trust us and rely on us to provide the services that we do.
Right, because that could be a worry that when the children, the adult children, go off to work and things like that, trust is obviously a big factor.
Exactly.
And so, what are some other issues that people, have when they come to you? Some uncertainties that they might have.
Sometimes they have concerns about letting an aide into their home. They're not used to having someone come into their home, and so it's a matter of developing trust And usually once that's established, the aide really becomes more than the person who's preparing the meal or the person who's cleaning the house. It's really a companion for them. I recently read a bunch of surveys talking about getting the client experience, and so many of them mentioned the wonderful aides and how much they rely on them, and it's really touching how much an effect an aide can have on a client's life.
Right, friendship, of course, very important.
Absolutely.
Okay. As we age, the chances increase that we'll face a health crisis. We'll learn more after the break. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about quality of life issues for older Americans. The aging of the U.S. population is increasing the demand on our health system. Government statistics show 76 million baby boomers will age to Medicare in the next few years. Healthcare can deteriorate over a period of time or can occur suddenly, such as a diagnosis of cancer, heart attack, or stroke. Such illnesses can be debilitating, but some older people are fortunate to be active and healthy into their 80s and 90s. Let's discuss some of the more pressing issues surrounding health and healthcare for older Americans. So our first question is, what are some of the most common health issues that older people are dealing with?
Absolutely, Alzheimer's and dementia is probably number one. We're fortunate to have 4 certified dementia practitioners. In fact, Anna is one of them on staff. It doesn't just affect the individual, but the families and the caregivers. And we do an awful lot of work both with the individual and caregiver respite and programs like that. I don't know if you want to touch more upon that.
Well, absolutely. And it is a problem that continues to grow. The Alzheimer's Association says that by 2025, the increase of older adults living with dementia and Alzheimer's, or Alzheimer's specifically, which is just one type of dementia, will increase over 15%. So we're seeing a lot of people not only needing services for their loved one or themselves, but caregivers who need that support.
Right, and so we see in this area there are a lot of walks for, Alzheimer's, dementia, things like that, so definitely trying to bring awareness to that. How does that impact families who are struggling, help them feel a little bit more a sense of connectedness, like they're not alone?
Absolutely, and education is a huge piece of that. There's so many, misnomers and, myths about dementia and Alzheimer's that people kind of latch onto, and so part of our job is talking about not only your journey with dementia or Alzheimer's is individual. It affects people differently, and that is going to make your family's journey different. So it's all about making sure that they understand the disease and its processes and what resources are available to help them when they need it.
Right, and so going off of that, when should someone consider home health care?
I think first of all, it's never too early. It's always great to know your options and have a plan. I also think that when you start to see a loved one fail, when they start to have falls, when they start to having difficulty taking care of their home, when you're becoming concerned about them cooking meals, I think it's never too early to call Anna and I in our department, but those are some of the red flags for sure.
And what are the different types of home care?
Well, it depends on the program and really the payer source in some respects. But a person can have something as simple as someone coming in an hour a week just to do the housekeeping, or it could be much more complex in that this person needs companion services, so someone's coming over and playing cards, and they also need a home health aide to provide hands-on care, bathing, dressing, grooming. It really depends on the individual, but we're there to sort of help assess the needs as they go through this journey and add more services as time goes on.
And how about, the cost for these services? How are these paid for?
It really depends on the type of service that they need. Sometimes it's private pay, sometimes it's subsidized by the government, sometimes it's a long-term care insurance policy, and sometimes it's a combination of all three. The good thing is that Greater Springfield Senior Services, we can come in and supplement other services and really build that quilt of care that somebody might need.
And, what types of care require a doctor's referral before being approved by Medicare or an insurance company?
None of the service that we provide at Greater Springfield requires a physician's approval. I like to think we're a player on the team. There's the medical professionals and their opinion, and obviously that is valuable. But we're trying to address the social determinants of health. What are the obstacles that's in someone's way of becoming as successful as possible? And that's really our role, to put in those services in order to support the individual.
Most visiting nurse associations, so if you have an acute illness, a fall, and you come home from a hospital or rehab, those types of services where a home health aide and a nurse and physical therapy, occupational therapy are coming in, they do require a doctor's referral. But honestly, anybody, the family can call the doctor at any time to see if those services can be referred in.
Right.
We utilize that a lot in protective. It might be that the medication check, the nurse, the kind of the physical therapy to get them back on their feet. So those services, but I think the other great part is just having the services through Greater Springfield that don't need that referral, that we can kind of get into place really quickly and really assess the immediate needs.
And let's talk about exercise and nutrition. We briefly touched on that before, but of course, older people, they do have limitations. So what types of programs do you offer to assist seniors with proper exercise and eating as well?
We don't offer any direct programs, but if a person was to call into our information and referral department, we would probably be referring them out to senior centers. They have lots of great exercise programs. We also do offer evidence-based education programs, and those are run by volunteer trainers, and some of those topics are around healthy eating, chronic pain management, topics like that.
Yeah, we really try to collaborate with our senior centers and councils on aging, make sure we have a strong relationship, because they offer a lot more social programs such as exercise and that sort of thing, where we're trying to put in the home care and advocacy programs.
Right, and talking about physical health as well, how important is it for a senior to receive an annual physical? What types of things should they be screening for or having tests done?
I think it depends on the individual, but obviously I think at least an annual physical. I think if they're starting to notice a decline or family members are noticing changes in cognition, if they're falling, those are all red flags that perhaps it's time to do something beyond the annual physical. But absolutely an annual physical is always a great idea.
And in terms of, flu season, we're still in flu season and now we're seeing measles cases. How important is it for older people to be getting those vaccines, and do you provide those services at your center?
We do not provide those services, but a lot of the Council on Agings do, and we would strongly suggest that folks get vaccinated for all those that you mentioned.
And do you offer health clinics?
We don't offer health clinics, but they do a lot at the Council on Agings.
Okay, and so some people have smoked or abused drugs and alcohol for many years, and their health may be suffering as a result of, aging. So what type of programs are available that deal specifically with those issues?
I think we have to look at those issues from two different perspectives. Substance abuse may result in some cognition issues with the elder, but it could also be a family member who has a substance abuse issue that's affecting the care of the elder, and a lot of times that's when Taryn's department becomes involved. They may be an impediment to the person getting the care. I don't know if you want to speak to that.
Yeah, no, it's definitely, obviously we've had elders who have smoked a lot of their lives, so getting them to quit after smoking for 40, 50 years can be a problem, and it also culminates into other problems. Their risk of housing, risk of, just exacerbated health issues. So there are a lot of insurance companies that provide, smoking cessation types of programs that, our workers in protective can absolutely help them make those calls, hook up with their insurance company and see what's available for them locally.
And do you find that it's harder for elder people to try to, quit smoking, things like that?
Yes.
Yeah, and so
Old habits are hard to break.
right, and so maybe with having, the aides around and things like that, that friendship, that companionship might be a little bit easier, or what have you found?
Yeah, I think that they can cue them and encourage them. It's someone that they can trust. They may be more apt to listen to someone they're considering, a companion or a friend, as opposed to a family member who they might seem as a little too doting. So yeah, I think it can make a difference.
I think that also helps with the safety risks, that not only the health effects of smoking, but smoking while with oxygen on or in the homes, falling asleep while smoking, memory issues that are causing them to leave lit cigarettes places. Having those aids really is another line of defense to, okay, we don't have them at the point where they're quitting yet, but can we keep them safer?
Right, very important. And we'll continue our conversation after a short break. You're watching 22 News in Focus. You're watching 22 News in Focus, and today we're talking about the health and well-being for older adults. We've discussed physical health, but mental health issues play an important role in the well-being of older adults. So how often should older people be screened for things like depression, dementia, Alzheimer's disease?
I think it's important to talk to their doctor as soon as they think there might be a problem. There's a lot of stigma around both of those issues. And not only should they be talking to their doctor, we as a community need to be talking about that more to kind of lessen that stigma and let people know that it's okay to talk about your mental health issues. It's okay to talk about if you have a dementia diagnosis. So the more frequent, the better.
And so how, would a child be able to tell that it might be something more serious like dementia and not just typical, memory loss, things like that as you age?
Yeah, I mean, it depends on the type of dementia that the person might be experiencing, but when there's an issue with driving, not just forgetting names, but forgetting to take medications, forgetting doctor's appointments, that sort of thing, any sort of red flag that you might have, it's best to talk to your doctor because there might be an underlying issue for that behavior. It might not be Alzheimer's or dementia, it might be a UTI or something like that. So the more communication you have with the doctor, the better.
How about programs available for families and caregivers to help prepare somebody who might be living with this?
Oh, we have a wonderful caregiver specialist on staff who is also a certified dementia practitioner, and she will go in with the family and work with them to talk about the stages of the disease, every step of the way, what services are available. We also have a specific case manager in our state home care program that her caseload is just dealing with families who are caring for somebody with Alzheimer's and dementia. And we also, the caregiver specialist and myself, we've run frequent programs called Savvy Caregiver. It's a free evidence-based program. It's 6 weeks where the caregiver comes to us and we teach them about what is dementia, what are they going through, what are the stages, and kind of helping them not only deal with and manage the care of their loved one, but also take care of themselves at the same time.
Right, and how about in terms of dental care? Of course, the cost of dental care, a lot of people can't afford, but the CDC is saying 25% of adults over 65 aren't living with their natural teeth. So what about services for reduced cost of dental care for seniors?
Well, there's definitely, we're lucky in the Springfield area, especially there's several community health clinics that offer discounted dental programs, not just for seniors, but for the community. And the other thing is, as the research has come out in the last couple of years, that dental health really does play a big impact on your overall health. Some of the Medicare plans have started to offer additional dental benefits. So we encourage people to really take a look at their insurance and see if there's any benefits that they can tap into.
Right, and so more now than ever, we're getting texts, we're getting emails from people trying to scam us, and they're really, they're preying on the elderly. So what programs are available to educate the elderly? You might be able to answer that question.
I think it's also a lot of councils on aging and senior centers. I've gone out and done a lot of trainings with town and city police departments around what to look for. What would be the sign of, is this real? Is this really, your grandson, did he really get arrested and they need bail money? What to look for if they're asking for gift cards or cash. It's kind of just really in the communities putting out there what those things are to look for, because they're very real looking. I mean, any one of us could fall for them, never mind somebody who's, they're playing on emotions, they're playing on people with, cognitive issues. So really knowing, getting out to your local towns and communities and just giving them the signs to look for.
Yeah, very important. And computer literacy is important as many local, state, and federal government businesses, it can be done online. Do you offer any computer education courses?
We don't, but we would direct folks to their Council on Agings because a lot of the Council on Agings will offer trainings there.
Right, and so a lot of seniors might not be able to afford a computer and things like that. So are there any programs out there that can help people be able to afford electronics devices, things like that, to help them, stay?
Well, I would encourage them to certainly talk to their councils on agings. Occasionally there is grants for certain technology items, but most of the senior centers have computer labs specifically for seniors. The Ray Jordan Senior Center in Springfield, they have a beautiful state-of-the-art computer lab, and they have free programming for people to teach them how to use the computer, how to navigate some of the systems that are now unfortunately going more online as opposed to paper forms.
Do you want to add on that? Or?
No, I was just agreeing. Everything is online,
Yeah.
so the more education, the
Right.
better, really.
The other piece of that is the councils on agings, they have outreach workers, and it's their job to help kind of navigate some of those public benefits, and they're a great resource to tap into to help with public benefit applications.
Right, and so we briefly touched on this before. Another problem for some older people is elder abuse and self-neglect. So could we kind of talk about the options out there?
Yes, anybody who's concerned in the community can call. We have a central intake for the entire state, and it's one number. It's 1-800-922-2275. All of the information goes there, and they get sent to each agency based on geographic location. Here, right in just Greater Springfield, we've received over 800 reports of concern since January 1st. And that's just our catchment area. We do investigate self-neglect, caretaker neglect, physical abuse, sexual abuse, financial exploitation, and emotional abuse. So we really kind of get in there and see what's going on, what's the best intervention, and what the elder's going to accept. Obviously, an elder that has capacity and isn't suffering from a cognitive deficit has the right to make their own decisions. So we offer what we can to try to alleviate as much of the risk as we can.
And how important is it to have, a social life when you start to age? A lot of people, they're stubborn, so maybe they're fine with how it's always been, but, what would you say about that?
Well, I think you have to look at their history. If they were never the personality who was hosting parties, they're probably not going to host parties now. But if they were that person, then we want to connect them perhaps with transportation to the senior center. Unfortunately, a lot of folks, some of their friends may have passed away. Their children no longer live local, so they do become socially isolated, and so they are at risk for self-neglect, for poor eating habits and things like that. So it really is important to have some sort of social interaction.
I think it's a lot of the elders we deal with in protective services do have that social isolation component, because people know nobody's watching is another thing. There's no one involved. There's not a daughter coming over to check on them weekly. So, they know that this is a vulnerable person, and they tend to be more the target of either scams that we see on the internet or on the phone, but as well as people who they know and in the community.
Right, and so just quickly, we've all seen the commercials where, people are at home and they're alone, they've fallen. Things like alert button services. Could we talk about that?
Yeah, absolutely. We do through our state home care program. Folks who are eligible for that program, in addition to some of our senior care option programs, they are eligible to receive what they call a PERS button, which would notify a company that there was a fall or that they're in need of assistance. So that service is available through us as well.
Thank you. For some older people, living alone and getting around becomes difficult. We'll discuss housing and transportation options when we return. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about health and the well-being issues for older adults. As we age, sometimes we lose our independence, whether it's giving up a driver's license or having to move in with family or assisted living. So there's been a lot of debate over whether or not the government should legislate when someone should give up their driver's license. What have you guys heard about this from family members' concerns, things like that?
I think driving's always a concern. Obviously, the person's at risk as well as people around them. I don't think we hear too much about, like, a certain age. I've had clients that are in their late 90s that are better drivers than most. So it's really more of, there's more of a reason when you're starting to see, are they getting lost? Is the car dinged up? And, medical professionals as well as police can actually write to the DMV for a temporary taking away of the license, but they also have the right to take a test to prove that they can drive. So I feel like now there's nice that there's a way to protect people, but there's also a fail-safe for that person to have the opportunity to get their license back if it's appropriate.
Right, and so we were talking about dementia and Alzheimer's, things like that. Of course, that could be dangerous if somebody gets behind the wheel and they can't remember where they are, maybe get lost. So what would you say to family members, friends, if you're starting to see some of those red flags?
I would say that the first step would be to know what transportation resources are out there, so that when you do have that conversation with your loved one, you can give them some options. I think, especially in America, especially in suburban America, driving is like the last bastion of independence. And so it's really difficult to tell somebody that they need to give that up. Especially with dementia, they might not realize that anything is wrong. So having enough information to be able to offer options to somebody is the first step.
And what are some of the transportation options in our region?
Well, certainly PVTA. We do, like I had referenced earlier, a restricted program for those frailest folks through our state home care program. I know King Ward services more of the remote areas, and there's a few other providers as well. A lot of the Council on Agings have transportation problems. Well, they have transportation problems, but they offer the service as well.
And what about transportation for the physically disabled?
It's really the same services that I just referenced as well.
Okay. Are there any organizations that offer rides for free or reduced costs for maybe people who don't want to, take public transportation?
I don't know if you're aware of any.
Most of the senior centers offer councils on agings in your certain town have some sort of transportation program that's going to be a reduced fare. I would also encourage people to look at veteran services. One of our community partners, Springfield Partners Community Action, just started a transportation program at a low fare rate. So there are services available out there. It's just finding that information. So we, encourage people to call the INR department to get that information.
Right, and so as people age, they may have trouble keeping up with their property, mowing their lawn, cleaning the gutters, interior upkeep. What are some of the resources out there?
A person could be approved what we call heavy chore, and those types of activities would qualify for that type of service, but they would have to be part of our home care program for that.
And when should relatives, friends, caregivers have the talk with an older adult about moving in with somebody else or assisted living?
Well, it's never an easy conversation. I think the earlier you have conversations about your wishes, the better it is. I think it's always good to go and see these places while you're well, so you sort of have a plan. I always encourage folks, once you make the decision that you want to go look at assisted livings, to look at the activities calendar, to stay for a meal, to really kind of get a sense of the place and see if you could see yourself fitting in there. But the sooner you do it, I think the better.
I think when you start feeling uncomfortable, you go on that home, you visit mom or dad, and you just get an uneasy sense when you're leaving. Are they going to cook something later? Is that going to be a problem? Or are they going to, there's wandering. I think when you start to get that apprehension about, am I comfortable leaving here right now? It's definitely time to start looking at the options and really start pushing the conversation.
Right, and so when you start having that conversation, that person might think that assisted living is like a nursing home, but they're different. So could we talk about the difference between the two?
Yeah, it's a residential model. Essentially, you're renting an apartment, and services are being provided in. So I think if people went and looked at assisted living, they would see there's definitely a difference between assisted living and sort of the traditional nursing home. And I think they might like what they see. But there's also, a lot of services that can happen in the home, and that shouldn't be, neglected. I think first calling INR and finding out all the services that can happen in the home is probably the first step. And then once that's been exhausted, then I would encourage someone to look at assisted living or a nursing home.
And when would you say it'd be an appropriate transition from an assisted living program to a nursing home?
Usually when someone is sort of a total care, they're totally dependent, they really can't dress themselves, they're not able to administer their own medication. I will say a lot of assisted livings provide a lot more services than they have in the past. So I call them sort of the nursing home of the 90s. They're providing more and more services. So not every assisted living is created equal, so it's important to find out the differences between assisted livings. But it's great to educate yourself now before you have to make the decisions.
And so what are some of the programs offered at assisted living? You know, maybe somebody loves to go to the movies or they love to dance. Are there options like that available?
Yeah, absolutely. I think it's important to look at their calendar of activities, see if they would allow you to participate. I think it's great to also look at the residents that they have living there to see if they're actively engaged. It's important for someone to maintain as much independence and as much as themselves as possible. Are the activities related to the things that once interested them? I think there's a lot of value to assisted living. It's a great model in terms of socialization, but it is hard for someone to leave their home. So I think there's always that balance. Socialization may be more important than staying in someone's home, especially if someone has begun to socially isolate. That might be the right model for them.
And I think a lot of people think of arts and crafts, they kind of think of that typical, activity. I've seen assisted livings that have therapy monkeys come out, really fun
Yes,
things that
right.
are different and engaging, especially as it is, the population is changing, the kind of people that they're serving is changing. So it's more, computer classes or movies or, again, therapy animals coming in. So it's much more variety other than the typical things I think most people think of.
Yeah.
Right, and in terms of visitors, some people might think I go to an assisted living and my next door neighbor, I'm not going to be able to see them all the time because there's strict rules. What are some of those?
Typically there's no real restrictions. Perhaps overnight guests might be a restriction, but that would depend on the assisted living facility. But a lot of assisted livings have rooms that you can book to have special events, celebrate a birthday party or a holiday event. So there's a lot of opportunity to still have connections with family and friends, similar to the way they used to in their former life.
And lastly, who oversees these facilities?
The Executive Office of Elder Affairs oversees assisted living, and then the Department of Public Health oversees nursing homes and rest homes.
Right, and so what would you say are some of the best benefits of assisted living?
Definitely socialization. I think assisted living tries to be sort of the least restrictive, encouraging people to still do activities of daily living. They're going to queue, they're not going to actually perform it unless the person really needs it. But I think the socialization and sort of the built-in checks, Phyllis didn't go down to lunch, so let's go up and see what's going on
Right,
with Phyllis.
important, of course.
Yeah, but it's sort of done subtly and not as invasive. But I think there's a lot of value to both assisted livings and nursing home. They're both needed within the spectrum. But I think a person has a right to choose to stay in their home for as long as possible, first and foremost.
Okay. Most older Americans live on a fixed income. After the break, we'll have some ideas on how to keep your money safe. You're watching 22 News in Focus. You're watching 22 News in Focus, and today we've been talking about well-being issues for older adults. People who live into their 80s and 90s may outlive their retirement nest egg and be dependent on Social Security and family to provide financial support. Seniors worry about the constant increasing cost of living, as well as a sudden and unexpected large medical expense. When looking to save money, people turn to senior discounts and try to limit expenses. Financial professionals recommend that more people consider working beyond retirement age to shore up their finances, and then take some serious steps to reduce their biggest ongoing expense, which is the cost of housing. Do you offer any financial literacy or planning programs for your clients?
We don't offer those services, but we can certainly direct people to those types of services. We do have a money management program, and that is pretty much folks who have experienced issues with paying their bills, who may have jeopardized their housing, who may have creditors calling, who may now have some cognitive issues, and they need our assistance in terms of getting their bills paid and keeping them, allowing them to stay in the community by us paying their bills.
Right, and so some people may stop buying food or need prescriptions in order to pay for housing and fuel. What type of programs are out there so people don't have to go without these necessities?
Well, first and foremost, there's the Meals on Wheels program. There's also congregate dining sites as well. But that's a voluntary donation of $2 per meal, which is extremely affordable. So first and foremost, no one should really have to go hungry. And in terms of other services, it really depends on your income. You may qualify for a program that's paid for by Mass Health or your insurance program. But I think it's great to call the agency, and we can really help direct you to those types of discounts or programs that are sliding scale, so that people aren't spending all of their money on healthcare type services.
Yeah, we have a great program at GSS called Options Counseling. And that's a free program for people who maybe need a little bit more than just a phone call to the INR department. The options counselor will go out and sit with them and kind of go over holistically what's going on with them, and then tailor the information to that person directly. So they're going to know about all the public benefits that they might qualify for. They're going to know about the medication discounts that are available. So the services are out there. It's just wading through all the information to get to the program.
And you mentioned Meals on Wheels. What, is the cost for something like that?
It's a voluntary donation, so it's really what they can pay. Sometimes even family members pay for them, so we're pretty flexible. But it is a voluntary donation, which is important to note.
And some communities offer community service to seniors to help pay for property taxes. Can you think of any resources out there off the top of your head for something like that?
I know the town of East Long Meadow does allow seniors to do that, and there may be other towns in our catchment area that have that as well.
Most towns offer discounts for not only seniors but widows and veterans, but they all have different eligibility criteria. So we really encourage people to call their local town to see if they might qualify.
And another difficult subject for families is funeral plans. So when should funeral planning be considered, and how do you walk somebody through something like that so it's a little easier?
Well, it's never easy. But once again, it's the ability to choose. I think of my grandmother. She wanted certain songs sung at her funeral, and I'm so glad she shared that with my uncle, because I would have never have known that. So the sooner that you can plan, the better. Sometimes funeral planning is encouraged in order to spend down funds so that someone may qualify for Mass Health. So that may sort of force the conversation sooner rather than later.
I think sometimes we have to approach it from a practicality standpoint. It is a very emotional subject and a very emotional conversation to have. But if you look at it from a practical level of you're making your wishes known, you're having the options, you're knowing how much it costs, you're letting people know, and not only that, but you're also making it easier for your family in the event when you pass away. So most people want it to be an easy transition for their family. They don't want to burden them anymore. So having it already planned and their wishes known is just easier.
And to know their family's not going to take on that cost
Exactly.
because nothing was planned. I think that's probably a good way to talk about it too, because a lot of people don't think of it that way, but when you broach it that way, it maybe lessens the kind of, the uncomfortability of the situation to, really have that plan in place.
Right, and what are some of the more common financial risks and needs that you see from your clients?
I think in terms of financial risks, folks who are having cognition issues, they're particularly at risk for exploitation, and I would say financial exploitation is probably one of the top forms of abuse that we're investigating right now.
And it's not so much those scams that we talked about earlier, it's family. In order to have protective services, the alleged perpetrators, we call them, needs to have that personal connection. So most of the people who are being financially exploited, unfortunately, it's by close family members.
I would also add to housing. When you look at the housing costs for everyone, just go up every year, and so when you have somebody that's already on a fixed income, and choosing to stay at home and choosing, to pay their property taxes instead of their medications, it's that balancing act that they're at risk for.
Right, and so also we were before talking about isolation, how important it is for people to have that companionship. And we were saying most communities provide senior centers or elderly services, but sometimes these locations are the first to face cuts when communities face budget shortfalls. So how important is it, that this doesn't happen, that there is enough funding to go into these places?
You are absolutely correct. They're absolutely essential. I like to think of them as our appendages.
Yeah.
They allow us to expand our reach in the community. We presently fund outreach worker positions. We fund some nutrition programs at those sites, as well as, in particular, one COA, we're funding a transportation program because they are remote and PVTA doesn't service that community. So we're really only as good as the senior centers. They provide so much benefit to the communities. They understand the culture of the community. They have the pulse of the community, and I think that they are absolutely vital organizations.
Right, and so going off of that, could we just explain again, what options there are at senior centers, what resources, what things there are for people to do?
I think it's great. It can be social opportunities. Some of them may have line dancing or ballroom dancing. I know I volunteered to serve dinners at one of them. They have Friday night events. They have some pretty fierce pitch games going on. They have computer classes. So I think they appeal to sort of all forms of wellness. They're stimulating people intellectually. They're sort of feeding the soul with some of their congregate senior dining sites. And I think it's lifelong learning with some of the evidence-based trainings that are offered there and the computer trainings that are offered there. So it's a great opportunity for the community to come together.
They take bus trips, I think make new friends, not only the friends you had, but as you start losing your friends, going to the senior center and making new friends and kind of sharing those new memories with the people that you're meeting in the community.
I think
Go ahead.
They
also all have outreach workers who have a huge knowledge base of what services, not only specifically to that town, but on a regional level of what's available. So it's that one-to-one connection and knowing the person and what their needs are.
And we'll have the last word for you after the break. Stay with us. You're watching 22 News in Focus. You've been watching 22 News in Focus, and today we've been talking about the quality of life issues facing seniors and the elderly in our region. That's it for our program today. We want to thank our guests for joining us, and of course we want to thank all of you for watching. If you missed any of it, you can watch it in full on our website, wwlp.com. From all of us here at 22 News, have a wonderful afternoon.